asked Dr. Madden to for this session. And on NGT, I've known, we were just chatting before, I've known Lynn for well over a decade. We can't quite decide, but it's probably closing in on 20 years. And since she completed her PhD, she's been really an expert in NGT and nominal group technique. She's an assistant professor here at Yale in the School of Medicine, but also the CEO of the APT Foundation. For those people who are local to New Haven, you might know of the APT Foundation. It is the largest addiction treatment, one of the largest addiction treatment programs in the state of Connecticut, with over 7,000 patients. So she's got a lot on her plate. She's an incredibly bright and energetic woman that I'm so pleased was able to join us for our opening session for this academic year. We will have another presentation later on in the year on NGT. So hopefully we can get people to kind of start thinking about something that may be much more of a novel technique that they haven't used before, but that may be very useful to them in their own research. So that's what we're hoping for in this session and the other session that will come later on in the year. Without further ado, I'm going to turn it over to Lynn. Welcome and take it away.
Thanks so much, Loretta. I was joking with Loretta that, you know, my health, my good health, which I'm fortunate to enjoy, is partly due to her because she introduced me to a wonderful dentist way back in the day when I first moved to New Haven. So we have known each other for a while. I'm going to be talking today about using nominal group technique to elicit barriers and facilitators, and potentially, and I will show you some examples of using nominal group technique as a research strategy as well. So I love nominal group technique and I use it a lot. I am trying to advance the slides, but they're not moving forward. Here we go. So one of the key, the piece of the title, and one of the key purposes of nominal group technique, which is really a mixed methods approach, so it's both qualitative and quantitative, is to elicit barriers and facilitators. And eliciting barriers and facilitators is really a common strategy for change management, for example. It's a common strategy in implementation planning. And it's a common strategy to really further our understanding of an issue, a group, or a challenge, right? So you might use this from a psychology perspective, from a program planning perspective, from an anthropological perspective. There are a lot of potential uses for nominal group technique. And I find that it's a way to involve staff, prospective or current users of a service or program. It creates cohesion around the question, which we'll get to momentarily. It can help the group or a team really move toward creating new opportunities. And when you're involved in implementation or change management, we really see change toward a goal or movement toward a goal as a regular and ongoing element of the work. And so I often find that people, organizations in particular, public policies, we think we solve a problem, right? So we're at this sort of definitive solution place, when in fact problems continue to evolve and change over time. So we can use nominal group technique to sort of take the temperature of where we are in any given situation and try to determine what we might need to do next to keep moving toward a particular goal. And the question always is, how do you find new ideas? You know, how do you generate baseline data? How do you meaningfully actually involve constituencies at all levels, right? This is a big, I think, conundrum for many of us in the public policy or public health universe, is really trying to meaningfully involve those persons we call patients or consumers, or persons who will be kind of the end receivers of a solution that we might come upon. And I think one important way to do this is really found in nominal group technique. I will tell you this, the definitive reference is from 1975. The lead author there is a person called David Gustafson. Dr. David Gustafson is my personal friend and mentor. So I actually can trace my roots in the use of nominal group technique, if you will, to the persons who actually created and published on this methodology. They also, many of you might be familiar, they also in this same publication really for the first time describe and outline the Delphi method. Right, so both the Delphi method and nominal group technique are inherent in this one text that is considered pretty seminal around group techniques for program planning. So the nominal group technique is really designed to promote group participation in the decision-making process. It has its roots both in social psychology and in engineering. So that the people, Delbeck and Gustafson, are both well-known in engineering. Others on their team are from social psychology. And you'll see as I walk through the steps of nominal group technique, the ways in which principles of social psychology are really inherent in this approach. It can be used by groups to reach consensus on the identification of key problems or in the development of solutions that we can actually test, right? So it has double or triple utility in this particular way. I will give some examples of that. And I should also say, anyone who has a question, I am not especially formal. If you want me to pause and explain something or to talk with you a bit about something else, I am happy to do so. So please just jump in there. So we can use this to create group consensus and to identify key problems in the development of solutions that can be tested. And again, I find this to be a really important point. So you can use nominal group technique with any kind of group, right? It can be a group of people who might use a particular service. It could be a group of people who are already using this service. It might be a group of people who are providing this service, right? But it's important to know who's in the group. So when you actually pull your results together from a methodological point of view, you need to be able to tell which constituency you might have been hearing from, right? So it's important to understand who's in the room. My favorite size for these groups is something under 15. So 4 to 5 people and fewer than 15. I must say I have done this in rooms with 150 people. So it's entirely possible to do that. And that makes it a supremely flexible approach to use. So when we think about nominal group technique, we have 4 steps, right? And the first step is silent idea generation. I'll go over these in depth momentarily. The round robin recording of ideas, the serial discussion of ideas, and final voting, right? So 4 steps in conducting a nominal group technique. You can do this with 100 people in less than an hour. This is one of its other real advantages in the field, right? So if you want to do a series of nominal group techniques, if you're in a place that you're visiting, for example, perhaps a research site, you could organize yourself to do 4 or 5 nominal group techniques in a day and hear from really multiple perspectives, people who may be involved in various ways in a particular scenario or situation. So in step 1 is to clearly present the question. So it's important to think very carefully about the question and how you phrase and frame this particular question. It should be framed objectively. So something like, what are the barriers to providing clean needles in downtown New Haven? Right? A really simple question. What are the barriers to? right? Or what gets in the way of. What you're trying to do there is avoid questions that are feeling based. How do you feel about syringe services in downtown New Haven is not the same question. When you frame it objectively, you are still going to get some subjective answers. So for example, I don't like syringe services, right? That might be what somebody says to you as a barrier to actually doing it, or a public opinion is against this, or people are afraid of it, right? But they may also say things like it's against the law, or there isn't anybody to distribute it. So there's the reason to frame the question in an objective way is you leave the door open for both those kind of more subjective types of potential responses, as well as structural or objective types of responses. So important to frame your question. Go through it with yourself a couple of times. You can test your question by asking colleagues, right? But what you're really after in this particular set of examples is trying to elicit people's ideas about what the barriers are in the particular situation. After you get your question nicely framed, ask the group. Now, I don't publish the question in advance. I tend to actually bring the group together. It's always a question related to a topic, so it's not secret shopper here, but it's really, you don't lay the exact question out in advance. I find one of the advantages to that is everybody receives the question at the same time. Everybody is thinking together about the question, and people's ideas rise to the top simultaneously. So you get a more spontaneous set of responses this way. In silent idea generation, we encourage the participants to silently and independently write their ideas down at the table, right? So why silently, right? So the benefits of silent generation really include adequate time for thinking and reflection on each person's part. So for those of you who are really, involved in qualitative approaches, you'll really appreciate the idea that each person's ideas are honored in this particular approach, right? Each individual person has the opportunity to think quietly to themselves at first. Everyone gets the same amount of time to do so. And this time, if you will, should be extended to perhaps a little longer than the group's comfort level. So I have a person who tells me if you want to give people 2 minutes, actually push the button on your phone or whatever for 3 minutes. And the reason for that is in that last minute or so, different kinds of ideas, and here's again where the social psychologists come into play, right? Different ideas are going to be rising up in the room or in your own mind or the mind of your participants. So silent idea generation allows this adequate time for thinking and reflection and some spontaneity. It promotes social facilitation. You see the other people involved who you may or may not know writing things down. It avoids interruptions. It avoids the undue focus on a single idea right off the get-go. It avoids competition among participants, and it also avoids status and conformance pressures between participants. So in a more traditional focus group approach, we have all had the experience where a person or two really dominates the conversation, and it's more difficult to get ideas from everyone or feedback from everyone because whatever was initially brought up sort of takes up the time, or the first couple of ideas take up the time. So this is a way of trying to be sure that everyone's ideas will be able to be surfaced and that there isn't any kind of conformance or choosing prematurely between ideas. This honors, as I said, each person's participation. It also promotes focus among the participants. So that's step number one. Step number two is the round robin recording of ideas. This is done by the facilitator. So as the facilitator, you are before the group. Ideally, you have a flip chart. You can do this with a computer on Zoom by creating a Word document that you can type into while people observe it. but you record each idea, one person, one idea at a time. So if we were to go around this particular group of around 18 people, right? The facilitator would come to each person in turn and say, repeat the question and then say, what's your idea? Without discussion. So you just say, oh, okay, what I heard is, you write it down as the facilitator. If other people try to chime in, you kind of gently remind them, we're going to do this one idea at a time, one person at a time, and discussion will follow this, right? So this is the role of the facilitator. As in most research techniques, there is work that the facilitator is actually doing. Loretta.
Yes, there's two things that I want to ask at this point. Thanks, Lynn. The first one is, have you had the experience where well, first of all, with 150 people, I don't know how you do that first step. That's another story. I don't want to get into that, but have you had instances where you get to a person and they don't have anything? They don't want it. And what do you do there?
Yeah, you just say, thank you. Loretta, do you have an idea? Or could you give me your first idea? And you say, I don't really have anything. Say, thank you. And you move to the next person.
Okay.
Right?
And then the other question I had, okay, that's good. I mean, it's good. It's non-judgmental. It's respectful. It's accepting. All good things to have. The other question is, do you generally run the NGT with only one facilitator, or do you have a facilitator and an assistant?
Yeah, really good question. So you can do either. It's a bit easier with two people, but most of us have done it with one person, right? And you really can do it. Depends on your resources and who's present. Often if I'm working, for example, with a group of people who I wish would be taking advantage of certain healthcare services, I might ask one of them to actually write the ideas down while I facilitate the group. So, you can just use your judgment there. But yeah, two people makes it a bit easier for sure. Yeah, so those are great questions. So we're doing that. This is the work of the facilitator, one of the pieces of work. So you're one person at a time. Use your group management skills to do this. Just thank people for their input. Make sure you're writing down what the gist of what they're saying. Then move to the next person. So one person at a time. In this case of the group we have here today, we'd write down 17 ideas from each person, or we'd ask 17 times. Then I start over again, going in the other direction, right? So if you're the number 17, you're the last person that's given their idea. I'm now going to say, do you have another idea? And I'm going to go around the group backward, right? So and so you go through the group over and over again until all ideas are exhausted. The work of the facilitator here is really keeping people kind of lined up and listening. And you do that by constantly kind of giving feedback, paying attention. What you're trying to avoid is stuff like saying, oh, that's a great idea, or right. What you're trying to do is just thank you. What I hear you saying is, right, and just put it down to the best of your ability. So then we move into well, let me first talk about the benefits of round robin recording. It promotes equal participation. And again, this is the work of the facilitator. There are always people in groups who are used to being more forward than others. It increases problem-mindedness, and it shows people that you can deal with a large number of ideas simultaneously, right? We usually get somewhere between 30 and 40 ideas in about 10 minutes, maybe 15 minutes, right? So we're going around the group. You get a lot of stuff that gets out there. It separates each idea from the person, right? So you're making a list. The list, eventually people forget, except maybe if you said it yourself, who said what. You separate the ideas from the person. You allow for the tolerance of conflicting ideas. And this is where the non-judgmental approach to listening really comes in, right? Every idea is simply an idea. At this stage, they're all equal. So we as facilitators need to be, cautious in affirming or not particular ideas that come forward. You just really want to, what you're doing is celebrating participation and the fact that people are really are offering something, including just their presence, right? It encourages hitchhiking on ideas. So what hitchhiking is a process that stimulates other people to think of an idea that they didn't actually write down during silent idea generation and allows them to say it in their turn. So if I come to a person or you come to a person who says, I don't really have anything to say, you still call on them the next time because now maybe they've developed an idea by listening to their colleagues or peers. Right? So hitchhiking is a really useful opportunity here. Again, from a social psychology perspective, you're really developing group cohesion around the question. Simply by asking the question, you are letting the group know that you care about the answer, right? And that you care about what they think they have to offer to the particular issue that you put on the table. So again, this is about a mutual relationship that's happening between the facilitator, the group participants, and among those persons as well. And the other benefit of the round robin recording of ideas is a written record. So when I use a flip chart, I literally would take a photo of it. Sometimes I pull it off the flip chart and I tape it to the wall. It becomes a work product that's visible for the people in the room and adds value, frankly, to the work that we're actually asking them to do. So when you get through that, your skills will be well honed by the time you get through the round robin recording of ideas. We have a question here from Deanne Turner.
Yes, I'm so sorry. I didn't mean to interrupt you there. Is everyone giving a unique contribution? And what do you do if someone states something very similar or maybe even the same as what someone previously said? I'm thinking with barriers and facilitators, this might come up a lot, like barriers to someone might say, oh, cost, and then someone else might say, well, perceived cost or insurance. Are you writing all of those down, or if something is duplicative, how are you dealing with that?
Yeah, that's a great question, Deanne. Thank you. So two ways. One, if it's literally the exact same phrase, I will point to where I'd already written down and say, does this cover it from your point of view? And the person will say yes or no. And you say, thanks so much. And you move to the next one. If the words are somewhat different, I simply write it down. And then when we get to step 3, that I just popped up on the screen, we have an opportunity for the merger of 2 or more like concepts.
Awesome, thank you.
Yeah, Loretta, you're on mute.
Sorry, I thought I hit it and I didn't. In the question that Deanne just asked, and your example of cost, and then somebody else says perceived cost, do you see that as the same or different?
Yep. So in the room, when we're first writing down ideas in step 2, I would actually write both of those down, right? If the word cost or even the phrase perceived cost came up more than once, I would point to it and say, does this cover it for you, right? In step 3, it involves taking each idea and clarifying them prior to voting. Right. So as you can see here, the benefits of step 3 are one of the benefits. It allows for the merger of 2 or more like concepts. So in that case, in the discussion period where you want to try to avoid very much discussion in the round robin recording of ideas because it starts to leave people out. Right. But yet when we get to step number 3, and as a facilitator, you're going through the list one at a time. Does anyone have questions about this idea? Does anyone have questions about this idea? Would someone like to add something to this idea? It's an opportunity for clarification and the elimination of misunderstanding between people. And I do a lot of this in languages that are not my own. So I'm listening to English translation and someone is writing in whatever language that we're working in. and I'm writing in English at the same time, right? So it's a really great way to kind of make sure that the concepts are well understood by the group. And then we do cross some things out, right? So that if you have 35 ideas, you may end up with 29 of them to vote on, because people cross them out. Now, I will also say that there are some people who do this a little more quickly than I would like, than I prefer, I guess I would say. So transportation and lack of childcare may be both structural kinds of issues, but they're not the same issue. So I tend not to lump these things together before voting and say, oh, this is a structural problem, right? The hours of operation and the location of the program might be very much related, but they're not the same issue. Right, so I tend to keep the list as open as I can before voting, if that makes sense. So again, here's where your skills really come in. You begin to really understand what people are saying and get very adept at trying to rephrase what they're saying if that's necessary, and trying to really hear them, right? So listening skills are very important in both steps 2 and step 3. So at the end of step 3, which again should take around 15 minutes, sometimes you have to end the conversation by just moving to the next step. And in the case where you can't get people to agree that two things are the same, you just leave them both on the list, right? So the difference here is that as a facilitator, you're not an expert in any way. You're really just eliciting ideas and trying to make sure that all the group's ideas stay present to the extent that they are unique from one another, right? And then we move to step 4, which is a lot of fun. The final step is voting on the NGT. So what I use is 3, 4, or 5 votes, and it kind of depends on the group size. So if it's a small group, you want to stay at that lower end of 3 votes, right? Because if it's a much larger group, maybe you give people five votes. But in any event, the number of votes doesn't matter so much as it's a multiple number and everyone gets the same. Okay, so it's got to be more than 1 and everyone gets the same. Have each person give their votes to the ideas that they feel are most important or most on target. They can give all of their votes to single idea. So if we have 3 votes, I can say all 3 of my votes go here, right? Or they can split their votes up, 1 here, 1 here, 1 here, or 2 here and 1 here. So they're literally rank ordering the list of ideas. So for those of you who are familiar with the Delphi method, this starts to get a little closer to that, right? So your group is literally rank ordering the ideas. One easy way of doing this, if you're doing it in person, is to provide these little sticky colored dots, or I actually use just colored markers. It makes the flip chart a little more interesting, and it also creates an object, right? So I talked about this as a work product. If you think about social psychology, this becomes an object or a product that's literally owned by the group. You can take a photo of it. You can send it to the group members afterward. Thank you so much for your participation. Wanted to just, show you all what the final results were, or remind you what the final results were, right? So you use check marks or some other voting method, and then we wrap it up, right? So we have closure. You compile the vote totals right in front of everyone. This is all very transparent. And then you report out to the participants the final voting tallies. Now, importantly here's the trickier part, again, for some people who are used to doing, for example, qualitative interviewing and coding every word that may be said by the participants. What we're really doing here is trusting the results. There will rise to the top 2 or 3 ideas, sometimes 4. But when you have 35 ideas, you really are going to leave out 30 of them from the final vote total, because they're going to have almost no votes or none at all. This happens all the time. And it can be really hard if you have preconceived ideas about, you know, what you think people are going to say. I remember doing this, or actually mentoring a postdoc doing this, who really wanted the answer to be stigma. And, you know, stigma just didn't have the votes. I mean, it really wasn't the answer from the group participants' perspective. And we went around about that a number of times. Like, you have to let the data, this is data now, speak for itself, right? You can create a table, and I'll show you a couple examples of that, where everything is present, but you will get results here. And the top 2 or 3 results are what you're actually looking for and what you'll be reporting out. The group can also, at this point, choose one of the top barriers and flip it around and ask a solution framed question, right? How would you solve this problem that you just identified as a barrier, right? So you can use this in both directions. Now let me move to a couple of quick examples. So I just want to say that nominal group technique is a recognized and publishable mixed methods approach, right? Here's a paper that a team that I'm a member of did in 2017, published in the International Journal of Drug Policy. If you go to PubMed and you query nominal group technique, you will get papers from all over the world, right? There are all kinds of researchers and research teams working on this kind of approach in healthcare and in other public policy kinds of arenas. But this particular paper was focused on nominal group technique among clinical providers to identify barriers and prioritize solutions to scaling up opioid agonist therapies in Ukraine. So here are the results. This is the results table, right? So you literally will take everything, ultimately, you can create a table from it, but priority number 1 came out here to be opioid agonist therapy dispensing and distribution policies, right? So we had 3 different teams doing nominal group technique. You can see team A's number of votes, teams B's number of votes, and team C. So that got 17 votes when we added the teams together. They were all working on the same day at the same time at the same conference with 3 different facilitators with the same question, right? So we had 3 groups of people. Because the groups were large, we asked them all the same question, and then we merged the results at the end. The priority 2 here became opioid agonist needs and assessments and slot allocation or places in a program. You can see the vote total there is 15. One group prioritized it higher than another. You can see that priority 3 was funding and financing. You have 3 teams meeting here, or groups. You can see that one group gave it no votes at all. But when we added all the votes together from the participants, these were the top 3 vote getters, right? So the rest of the paper really focuses on potential approaches to these ideas that were brought up. I must also say that was a 2017 paper. If you go to Ukraine today, despite the challenges of the war that is underway there, you will see that all of these have been prioritized, so have been solved. This group took this data and they sent a letter to the Ministry of Health, and they all signed it. So nominal group technique can also be used in program planning advocacy, right? We, the undersigned people, got together and we asked ourselves this question, and here's what we decided the priority issues were. Loretta.
So it's a good place to ask this one of what if your top 2 or 3 priorities to emerge from your NGTs has something that is a priority for them, but is absolutely not feasible for whatever what do you do about the issue of priorities versus feasibility?
Yeah, I mean, it's a different implementation question, right? I mean,
Yeah.
so it's a very good question. And so I have a couple ways of thinking about that. First of all, these barriers that get prioritized, or the solutions that get prioritized in a group, are simply what the group believes to be true. They may or may not be accurate. right? It's the people in the room believe this to be true. So back to the issue of stigma, right? This particular researcher was very interested in the group saying stigma was the problem. Well, the group didn't agree with that. It doesn't mean that the researcher was inaccurate. It just means that that group of people did not prioritize that as a barrier in that particular sense. So you always, this is a limitation, and it's always good fodder for discussion. I think that the people in this particular example that's before us would have told you that some of these potential solutions were not feasible at the time. There were laws against them, for example, yet they were able to persevere and move forward, and the country moved forward with them. So sometimes you have to put priority one on the back burner because maybe it is not as feasible in real time as priority two may be, right? So again, what this does is it just gives you a sense of the rank ordering of ideas among participants, which is fascinating, right? I mean, in many ways, it's really important to understand how people affected do in fact think about a particular issue, right? I mean, I've heard everything. I happen at Foundation, as Loretta said, is a substance use treatment organization. We provide opioid agonist therapies, including methadone. The things people believe about methadone are just even today, and 2024 just will blow you out of the water. But yet, these are fixed and firm beliefs among certain groups of people. And it is data that you have, really before you that you have to learn to figure out how to work with. So really, really nice question. Yeah, here's another paper from a group that came off that paper from 2017, a slightly different group of people looking to figure out patient preferences among people seeking treatment for opioid use disorder, a needs assessment for decision-making support. So one of the things that came out of the first set of ideas was people don't really know how to decide and how they would even begin to figure out what their choices might be around opioid agonist medications. So you have a somewhat different group of people who take up that question and begin the work of now what is actually just recently published, a shared decision-making aid for people in Ukraine, right? So this becomes a stepwise process. What do the people who we now call patients, really what are they thinking about their choices when it comes to treatment for opioid use disorder? How do you help them organize their thinking in ways that are more informative, perhaps, than the mythologies that abound, as I was just talking about? Here's a paper that uses nominal group technique to actually do that, right? So there's a lot of ways of doing that. And then I have one more example I just want to share quickly that moves into implementation science just a little bit more. So using NGT and implementation planning, here's an example I'm going to share with you where we actually mapped this NGT results to the socio-ecological model for implementation, right? So there's a lot of implementation models you can use, or frameworks, I should say, implementation frameworks. You can use nominal group technique to elicit barriers and facilitators to discuss your potential solutions in virtually any implementation model. It's simply an implementation strategy. It's not the implementation itself, right? But it's a way, again, of including people who otherwise are often difficult or impossible to include in a meaningful way. It's not the same to have somebody sit on a community advisory board who represents, for example, people who use drugs when everybody else on the board is not one of those persons. That's really hard to be that individual representative. This is a way of bringing groups of people together who may share characteristics and really illustrate their thinking on particular questions. So this SEM model understands healthcare and other systems, so this can be used across all systems, to be affected by the interaction between the individual, the group and the community, the physical, social, and political environments. So this model is a way of illustrating the importance of networks of people and the structures that might actually surround an individual. So here's a visual representation of the socio-ecological framework, right? Where in the center, you have the individual who's going to be affected by the policy, who's going to use the healthcare services. Around this person are the interpersonal circle, their friends, families, affected others, right? Around both of those is the institution. So it might be an organization, it might be a group of organizations. Around that, the community, and then the outer ring is really policy making. Where are the structural impediments? I find this a very useful model because it's very straightforward. It centers the individual, which happens to be a personal bias, but it also recognizes the individual as a member of these other circles, and it illustrates very nicely how the other circles come to bear on a particular person and their outcomes. So here's a quick example. We tried to identify implementation opportunities to scale up opioid agonist therapies for HIV prevention in Kyrgyzstan among people who inject drugs. So you can, in the United States, if you are a person who injects drugs, you're held in pretty low regard. I can assure you that in Kyrgyzstan, that's even a more difficult group of people to access. These are the authors. The first one, Anna Ilyosova, is a medical student in North Carolina, whom we mentored through this process. So this was a summer project for her last year, and I'm happy to say this paper is actually revise and resubmit at this point. So that's really cool. So Anna really met with groups of people who were identified as already being on methadone or opioid agonist therapies, people who were injecting drugs but who were not on opioid agonist therapies, and providers, potential providers. So she had 3 different sets of constituencies. These are tricky looking tables, but I'll show you an easier way to look at that. You can see that there are their aggregate participant generated ideas and results. They're stratified in this particular table by clients and non-clients. And the question, what gets in the way of the majority of people who use injection drugs in Kyrgyzstan from enrolling in the methadone program, right? So this is a question that started in English, was translated to Russian and several other languages, and then back translated to English. And this is what it comes out in English as, right? So here are the 3 cities, Bishkek, Chuy, and Osh across the top, the clients and non-clients, and here are all the results. All the results are here, and then also on the next slide, right? So all
What are
the results are
non-clients, Lynn?
Yeah, right?
What are non-clients?
People who inject drugs who are not taking methadone, Donna. Thanks.
Okay.
Yeah. So all the participants here are people who inject drugs, right? So she found a way, Anna Ilyosova, to show us all the results and everything that received a vote, and interestingly, everything that didn't as well. And it does vary regionally. But then the next thing that she did was she mapped these results in aggregate onto the socio-ecological model, right? So this is where she, as a researcher, and the research team really came together. She added up the results that you can see in the previous tables. She said the individual issues here are concerns about the harmful effects of methadone, misinformation, and fear of withdrawal, right? When we get to relationships, stigma, pressure to try new substances, negative attitude of healthcare workers, and methadone consumers being perceived as lower in class, if you will, than drug injectors. So you could use this kind of map, if you will, this SEM map, to really create different pathways of implementation depending on which kind of implementation challenge you were trying to solve.
Lynn, I've got a question. First of all, I think it's great in that it's a good method. What Anna put together in those tables is demonstrating a total transparency on what is going on, which is, I think, a very important part of anything we do in research is make it transparent. Also, I love the socio-ecological model. But I have a question of, did you already like anticipate using that model? I've often found that once we look at the qualitative data, we say, oh, it definitely fits in. We can kind of identify our themes in terms of the SEM. Were you using this, you had decided beforehand, or was it something that was like post facto?
It was definitely post facto. So here's the single question that was asked, right? And then at the end of the day here, once she went around to these various cities and ran these different groups and started to add together what she had for results, what you have in aggregate here is a little bit different than what's presented in the SEM framework approach, right? So in aggregate, what you have among non-clients, the most important, quote unquote, the highest number of votes goes to the negative effects of being on the narcology treatment registry, right?
Yeah.
Which also rose to number 8 among current clients. But the current clients actually said that the most important issue from their point of view was poor quality methadone. Right, so that would be a way of presenting results, which we did in the Ukraine paper from 2017. And by the way, there is an appendix there that lists all of the results, as you're suggesting. but in that particular way, we really highlighted the data, the top vote getters, if you will. And Anna did that as well, but went on to say, here's another way of looking at all of the votes that were actually cast given this particular issue.
Thanks.
Yeah, you're welcome. So again, you can use the SEM model if it lends itself to that. In order to use the SEM model in advance or any other model, I think you would have to shift your questions to be specific to the sphere of influence that you were trying to interrogate, right? This was not the case here. And the simpler and I think kind of more pure approach to just saying, here's the question without in advance kind of unpacking it to these different spheres of influence is the way to go. Certainly I think other people could make a case in the other direction as well. So with
What are
that,
the numbers? Oh, wait, Lynn, sorry. What are the numbers in parentheses mean on the previous slide?
this one, the SEM model, Donna, this is all of the participants all together. So that was good.
My question is, so if you look down under individual,
Yeah.
at the first bullet point, it ends with open paren 9, close paren. What does that 9 mean?
So concerned about harmful effects of methadone, 9 in parentheses, that's 9 votes.
Okay, that's what I wanted to know.
Yep, thank you.
So even something that had 1 vote appeared on here?
Well, that was the way that she chose to present this. Yes. See, now I wouldn't have done that in terms of the prioritization, but she took anything that had any votes and she put them into these spheres. So anything that didn't get a vote is not listed here.
Okay.
Yeah.
And that is very consistent with kind of what we strive for in qualitative research. It's not about generalizability, how many people said it. It's about depth of what was elicited from the group in response to that question. So I can see the rationale for having that one vote. And this was a fabulous, you have any closing
No, I just see a hand up there from Yuka.
Yes. Yeah.
There's also some great questions in the chat.
Yes.
Oh, good. I can't see the chat. Thank you.
I'll take care of that, Lynn.
Yep.
Thank you. This is so really, really interesting. And my question was, it seems like, for lack of a better term, like a rapid process compared to Delphi. My understanding of Delphi is there are rounds and rounds and rounds of voting as you whittle down to a topic. So would you agree that this is like a faster, rapid process?
I would agree with that. It is a faster, more rapid process. I also, in the moment, am involved with two different research teams that are doing Adelphi, and it's sort of like eating something that you really don't like. I've said to myself, I don't really want to do this again because it does have those kind of real layers. I think I'll get over that, but at the moment, it's been a really interesting challenge. You got on the same. In the same ways that you're talking about, just multiple rounds and trying to, be sure to be inclusive while simultaneously paying attention to what does get prioritized and letting that kind of lead the next round of interrogation. Yeah.
Because I think it is a real problem where the attrition of folks from one round to the next, you start to lose interest. People get fatigued. They don't want to participate anymore.
Yeah,
This
exactly.
seems like much less of a burden on the participants. But how long, I may have missed this, how long do you schedule these groups for if you're meeting in person and online? Is it more than an hour, I imagine?
An hour is plenty of time.
Okay.
An hour is plenty of time. Yeah. And often it's a bit shorter than that, like 40 to 50 minutes. So when Anna wrote her paper up, we're looking at groups that average around 55 minutes.
Per question, though, like,
yeah, per group.
Would you do several?
So we might do several groups, which Anna did here, using the same question. And the other thing that we do is we flip the question around sometimes when we're focused initially on barriers, and then we take the top, let's say, one or two vote getters around barriers, and we ask a solution-focused question. You can actually do that, both of those things, in an hour or so. Once your facilitation approach gets honed, and if you don't have more than, let's say, 10 or 15 participants. If you have a really large group, of course, it takes longer.
And Lynn, if you're working, in addition to larger group issue, if you're working in a different language, does that also, so what is your typical duration when you're having to go through a translator?
Yeah, usually we're using simultaneous translation. So it doesn't really change the group dynamic too much. Okay. Right? Yep.
We have several questions in the chat, but by the same token, if you want to just raise your hand and ask your question, please, I invite you to do so. Giving a little chance for people to raise their hands, but at any rate, so one of the questions was, have you ever used NGT where you skipped step one, the generation of ideas, and used the literature to determine what the barriers and facilitators are, and then had the group rank them?
No, I have not. I think that's more like a Delphi approach, right? Than it is really truly involvement of potential constituents. So I haven't done that.
You're looking not at the top down, if you will, from the literature. You're looking at getting the voice of the population of interest.
Yes, and I'm also looking at, I think there are various ways of talking about this, but trying to move away from the hierarchical relationship that may be inherent in reviewing the current literature, right? That these are experts. That's what the Delphi method actually lends itself to really well. It pulling together a panel of people where you kind of rank what the current literature really looks like and where the gaps are. That's a job, I think, better left to the Delphi approach.
Thanks. Another question is discussing feasibility of voted priorities part of the NGT, or is it a separate process? Is there a way to continue engaging the NGT participants to discuss this?
Yeah, that's a great question too. So in general, I kind of leave the feasibility piece to a next conversation, right? So what I'm trying to do here in general, and most of the persons I know that are working with nominal group technique is just see what people think. What do they really think? And then it's left to the research team potentially, or a next group of people to kind of talk about feasibility. I also think that, and I've shifted in my opinion about this over the years, that what we today might consider not very feasible is not necessarily accurate.
No, I heard that loud and clear in when talking about the Kyrgyzstan, and it made me think about, well, if it's not feasible, should we take it off the table, which we have done in the past, because you had, proof of it's not feasible now, but that doesn't mean it won't be feasible later. So that has been a good lesson for me. One of the other things that I actually am kind of, I don't know, conflicted about is you're talking in your NGTs, it's really focusing on the barriers and the facilitators. Generally, when we write our articles up as barriers and facilitators because that's basically what is wanted out there in the real world these days. But my view has always been that barriers and facilitators, there's an underlying thing that in one direction or theme, when we're looking at the qualitative data, that in one direction will be a barrier and the other direction will be a facilitator. Do you ever kind of get to that underlying thing in your NGT kind of approach?
Yeah, that's a really, I mean, we could have a whole conversation about that.
Yes.
I would say that I substantially agree with you that, one person's, meat is another person's poison kind of thing, right? That there really are personal or cultural perspectives that come to the table here. And you can see the same idea as both a barrier and a facilitator. And I think as a researcher, just kind of trying to stay open to that. Also, keep in mind from my experience, I will say, you have to build some credibility, right? And then part of this technique is about cohesion. And part of the cohesion that's developing is between you and the participants, among the participants, but it also becomes in the larger context of whatever research you're undertaking. If it's implementation research, you're going to have a wider leadership group out there in some way that feeding these data back to begin to shift that what feels like intractable kinds of barriers, intractable opinions, right? I mean, I do think that what barriers today can be tomorrow's facilitators. And you're accurate from my point of view that the words themselves are pejorative, right? They have meaning, and that's why I tend to use like slang English, what gets in the way of, as opposed to literally using the word barrier.
Yeah, I use challenge a lot.
Yeah.
So we are coming to we are beyond the top of the hour. Thank you so much. Do you have any closing remarks that you want to make to the group?
Thank you. I just want to say thank you, Loretta, to you and to everyone for your time. I appreciate you. Anyone who wants to talk more about this, I love it. So please be in touch. And Donna, I see, oh, you're clapping. I was going to say you have a question, but thank you. I appreciate that. Please be in touch. I'm here and happy to, weigh in on any question that you might have that we didn't get to today.
Well, it's most generous, and we really value your presentation. I learned a lot from it, and thank you so much to everyone for attending. Don't have the list up in front of me of the October presentation. My bad, but you will get an announcement of whatever we're going to be presenting, which I can't remember right now, in October. At any rate, everybody have a great weekend. Take care. Bye-bye.